and welcome to the Executive Room podcast, where we delve deep into the minds of remarkable executives who have shaped the business world with their actions and ideas. I'm your host, Kimberly Afonso, CEO and founder of the KA Consulting Group. Today, we're privileged to dive into the inspiring journey of David Theobald, CEO and founder of Davin Healthcare Workforce Solutions. Davin Healthcare is a nurse-founded and employee-owned healthcare workforce technology company on a mission to elevate the nursing profession. David Theobald is an RN MSN and currently enrolled in the DNP-ENL program at Baylor University, and he will share invaluable insights with us today on Davin Healthcare and how they continue to make a positive impact in healthcare and education. So let's get started. So welcome, David. Thanks so much. Honored to have you as a guest. I've been following you for a while on LinkedIn, so really glad to connect. And as you are the leader of your organization, we've seen that you have a strong dedication to education, patient care, community involvement in the healthcare industry. So I'd love to really start with the fact that your company is nurse founded from you and employee owned. How do you feel about that statement? That's something that we see listed a lot online. It's really powerful and inspiring. Could you tell us a little bit more about why that's so important to you?
Sure. Thank you, Kimberly, for having me, and appreciate the opportunity to be on your podcast and share a little bit of what we do as an organization. So, yeah, I think the journey of going in to be a nurse entrepreneur really started for a passion of helping people and caring for others. And I think the ability to be a nurse and understand what patients need, from patient care to outcomes to experiences, really helps elevate us as an organization and share that throughout our company and our mission and our values, but also to our clients and anybody that we touch. It's really coming from that compassionate and caring mindset. And in our industry, traditionally, that has been absent in a lot of spaces. And I feel like it's a breath of fresh air to be able to share that with others, our story, but also the story of, how we got here today, but what our vision is and what we're working on through innovation to help support the future of nursing and healthcare. So I appreciate you bringing that up. It's something I'm very passionate about, continuing on with nursing and supporting nurses' role in reinventing healthcare.
And do you think that that's something that's not so common in your industry because most companies aren't founded by people who have a nursing background, or is there something else contributing to that?
Well, I feel like that is certainly an area where organizations that have a clinical background, a lot of healthcare organizations try to hire CEOs either with a nursing or a physician background. So there's some type of commitment. They understand certainly we're running a business, but it's about people. It's about putting people before profit, understanding why we're here, and really generating a culture of caring. And within our space, that's an area where I feel like a lot of improvements can be made. Certainly there's opportunities, and we're all in business for many reasons, but having a foundation committed to patient care and excellence really puts us at a different level. And I really feel like a lot of organizations that have clinicians on their board of directors or within their healthcare organizations really do well in those areas of patient experience, outcomes, because they care about the core commitment of why we're in business and what we're doing to help people.
That makes a lot of sense, and thank you for sharing that. So, going a bit more into the origins of your company, can you tell us a bit more about your personal journey? We read online that you were a motorcycle accident survivor to a nurse, and eventually you founded and lead your current organization. Could you tell us a little bit more about what inspired you to get there?
Yeah, it's kind of a long story, but I'll give you I call it the 30,000 foot view. So my background of caring for others really started at a young age. Actually, my grandparents was helping both grandmothers, one that had a cancer diagnosis, and I remember my parents asked me if I could stay the summer to help out because they both had to go back to work. So I was 11 years old at that time, and I was helping support my grandmother at that time, and it really gave me a kind of a new experience of being a caregiver. I mean, I saw that in my parents, also my grandparents. So it's really being brought up in an environment of caring for your grandparents, your elders, and commitment to helping others. Fast forward, I didn't think I was going to be a nurse. I thought I'd go into a forest ranger. I was very interested in being outdoors and hiking and being, in an area where I love the wilderness. So I thought I'd be a forest ranger. So I was in school going to EFF, thought I'd be graduating and being out in a different environment. But as you mentioned, I was in a motorcycle accident. It changed my perception. I was involved, where I was able to see healthcare firsthand, either going through the emergency room, through rehabilitation, through rehab, to get better. I really saw, the commitment to nursing and healthcare. It really changed my mindset of saying, hey, this might be a different calling for you, and you might want to find a way to get into healthcare to help. And at that time, I think it was my biology teacher within my program. He was also a respiratory therapist. He knew my story. He knew kind of what happened. He said, you might want to think about going into nursing. There's a huge need. There's not a lot of men in nursing. Historically, it's only 9-10% representation of men in the healthcare field. And we need all types of diversity within nursing and healthcare. So he really talked to me and mentored me. Dr. Parati was his name. And at that time, I switched my major that next semester, and the rest is history. I just love caring for people. I love innovation within healthcare. I love, titrating drips and, creating solutions for patients to get out of the hospital. So it's always something I never regret, but by accident I got into it. So.
What a great story, and something that is so true and that I never thought about, but we really do see fewer men as nurses. So that's, really interesting about representation also from that point of view. So switching gears a bit, I found your open discussion about nurse leaders being underrepresented within the news and media really interesting. I don't think there's been a lot of awareness about this even after COVID. And in your opinion, what are the first steps to take for this to change?
Within the world, we're the largest profession across the globe. There's some numbers. There's 3.2 million nurses in the United States alone, but we are the largest voice collectively within healthcare. So we have a reason to be at the table, to be representation for what happens in healthcare policy, what happens with outcomes. I think when you leave us out of the discussion, it creates a vacancy for how do we improve what's going on? How do we improve the health of our populations, population health? How do we improve what's happened after COVID-19 and take, calculated steps to improve all the areas that we need to improve? So when we have the opportunity to share our voices as nurses, it really helps represent the conversation from a different perspective. A lot of organizations are seeing that and now asking nurses to be on board of directors or asking them to be part of the conversation, even legislation. More nurses are being involved in public policy, running for senators. And so I'm excited to say that nurses are more and more being involved in those conversations. But it's not just nursing, it's all parts of healthcare. It's interdisciplines, physicians, allied healthcare professionals. We just need more representation for our legislation to move the needle, where we have the highest per capita spending for healthcare expenditures and the least amount of favorable outcomes, comparatively to like 3 other nations across the globe. And I feel like that's unacceptable. We can't spend more money, on supporting patient outcomes and not have accountability for our legislation and our politicians. And we have healthcare professionals like nurses and physicians and other disciplines at that table. We can make those educated decisions on what policies make sense, and what policies. It's not about what's good for the economy. It's about what's good for the people. When you have healthier populations, it's better for the economy. So I feel like it's an economic wise decision to include nurses and different clinicians at the table when it comes to decisions that impact healthcare.
Absolutely. And do you think there are any quick wins or things we could do as a society to move some of these outcomes, as you were mentioning that there is a high spend and still issues within healthcare? Are there any things that you are seeing that you'd love for legislation to pass about, or that you think the general public should be more aware of?
Yeah, I feel like changing the mindset of nurses and healthcare professionals as being a cost center, as something as a burden on their payroll, as really a profit generator, a way to help support nursing indicators, process indicators, patient outcomes. I mean, but I'll tell you a little story. When we're talking about when nursing does well, the rest follows. And I feel like that's truly a really good tagline, and it's really true to commitment. And if we're really going to move the needle within healthcare, we have to see nurses as contributors and partners and helping support the success of getting down length of stays, infection rates, anything that has to do with the quality indicators, patient experience. Nurses are at the front line of those. So investing in nurses' education, investing in retention, health and well-being of our nursing workforce and clinicians is so important. Right now, we have a really high attrition rate of not just nursing, but physicians. There's a lot of burnout, compassion fatigue, and people are leaving the profession at alarming rates. So I feel like not only can we help support, the quadruple aim of supporting our nurses and healthcare professionals, if we do that well, we can really help support patients, their experiences, their outcomes. Just think of it. Have you ever been to a hospital, healthcare system, and you don't have enough staffing or staff that maybe is not compassionate and doesn't feel like they're listening to you? It really changes the perception of your healthcare and your experience. And every hospital is looking for reimbursements based on how well they're doing. Everybody's rated. And you have to really think as nurses as that ability to change that and help support the experiences, the outcomes, and all aspects of care. So that's the area that I feel like needs the most work. Looking at nurses as an opportunity to build that organization's reputation and also contribute to making those organizations more profitable.
Really well said. And it makes a lot of sense. Patients having a better experience, the whole system not being too overwhelmed, seeing nurses as a key part in that really makes a lot of sense. So thank you for sharing that. And speaking about how healthcare is evolving, we already talked about this a little bit and you shared a lot of great insights. But thinking about your company specifically, how are you as a company staying innovative and adapting to the changing landscape? And what role is your leadership playing in fostering this innovation right now?
Really, on that, it's about the culture and creating, I call it the transformational culture of leadership. It's really having an organization that it's not one leader that is, obviously contributes to the success. It's everybody within the organization is working towards that common goal. One of the biggest things that we've done as an organization is, change our structure to an ESOP, so employee owner stock ownership program. And one of the big areas that I see that's changed is our mindset of contributing to the overall mission, vision, and goals, what we're trying to accomplish within workforce. It really helps get those key stakeholders to the table, being innovative, collaboration, longevity, retention, and also a great retirement, especially for nurses. So historically, Americans aren't prepared for retirement. So creating an ESOP structure in addition to a 401k really creates a retention tool, but also a different way to help savings. We know 29% of Americans are not saving for retirement, and these are pre-retirement. We know that 55% of Americans have zero retirement at the time, so they're relying on Social Security and other means. So creating a structure where we're looking after employees is a great vehicle to bring innovation, but also help plan for retirement, plan for their abilities to have a peace of mind when they're looking at retiring. And, not everybody wants to, work for an organization for 20 years and get the gold watch. I mean, that's a thing of the past. So we're proud to say that we're the only nurse-founded and employee-owned MSP, managed service provider, in the United States. And there's a reason for that, because many organizations get to a size and they scale and they decide they either want to go public or they want to sell to an investor or private equity firms. That just wasn't an option in my mind. It's not a way to carry on your legacy. It's not a way to help support your employees. It's not a way to transform healthcare. I think you need a different way to do it. And that's why there's only 6,200 ESOPs in the United States. There's not that many, because it's a different way of thinking of it. You're not putting selling the organization as your top priority to retire and walk away with a big check. It's a longer play. It's a way to think about your employees as stakeholders, having a voice, and it's a really innovative way for organizations to scale, but also have succession planning for the organization. So I feel like that is the biggest area that in 2022 and into 2023 and beyond, that's our strategy to really help the people part of the organization be a part of what we're trying to accomplish. And for me, that says a lot. I think you can see it. You can see it when people show up. We have a very high retention rate of both our clinicians and our internal staff. And today, that's a very rare thing.
Wow. So that was a really impressive story, David. I personally didn't know all of those details, but you saying that there's only 62 businesses like that within the United States, is that what I understood?
6,200
Oh,
total. So yeah,
62.
it fluctuates, but there's under 7,000 total of organizations that take this pathway for succession planning. So I've been in the business for 20 years, and there's always options to sell for business owners. So I think about, as a nurse entrepreneur, what my legacy is, and it's always been about people. So I think for me it was an easy decision that you got to sell the organization to the people and grow the organization for the mission and the vision. And if you do that well, you really can create a great vehicle for the mission and what you're trying to accomplish in your organizational goals, but also it transcends to the client. I think clients understand that with an organization that has people that care about the organization, they have longevity and retention, they're going to have better customer service, they're going to have better experiences, and they're going to have a lot of transparency. So there's nothing hidden. We put it all out there and in our relationships, and it really makes a huge difference with retention of our clients as well.
Very impressive. And would you have any advice for other founders who are, have maybe are in similar situations to you, where they've been in the business for a few decades now and they're thinking about converting to the type of business that you created? Do you have any advice for them when they're thinking about, that decision? I'm sure there's a lot of pros and cons to it. It's clear to the outside. I'm sure that the pros far outweigh the cons with how you said really making a legacy about the people in the business, retention. I'm sure everyone is happier across within the organization or people working with your organization. But would you have any specific advice for other founders potentially going through the process?
Yeah, I think it's a longer play. So I'd say surround yourself with expertise, both on the finance, legal, and other areas. You really have to have a leadership team that's ready. It's not for every organization, so you really have to have a certain level of size to do it successfully. It definitely is a longer play for business owners that want to exit strategy, right away. It's more of a commitment to building a plan, building succession, and having the employees take over that ownership. But it's a slower transition, right? But you want to do it well. So I'd say just, recommendation is do your homework. Obviously, you want to be in a position where you're in a space which would make sense. And it really depends on your goals as an owner. There's a lot of ESOPs that are in different spaces. There's another one that's a brewery that we're actually going to visit. So they're 100% ESOP. So it could really transcend in the end industry as long as you have the right culture, the right leaders in place, and obviously you have to be in a profitable situation to be able to do that. So you have to be fiscally sound. So those are the big areas, and then if you ever want to talk to me or another ESOP owner, I would say join the ESOP association. And learn more. It's free. You can do your homework on their association and talk to, I call employee owners that have sold their business to their employees. That's a great start because it might spark some ideas if this is the right vehicle or path for you.
Great advice. And I'll be sharing a lot of the links you just mentioned after the recording as well with the recording. So moving to your leadership principles, it seems from everything you've said that you're a very transparent leader. Are there any other key guiding leadership principles or values that have really guided you over your career?
I feel like the ability to engage and energize your workforce, no matter where you are, obviously the challenges after COVID-19 and our organization going from a model of being in 3 offices converting to fully remote was a huge challenge. But the connection, the collaboration, and true transformational leadership is about leaders, not about titles. It's really about trusting your employees, now your employee owners, to really take projects, to be inspirational, to be innovative, creative, and you can't do that with a top-down leadership organization. You have to have innovation at the forefront, and the ability to do that is really just create a caring culture that recognizes but also celebrates what ideas and what creativity each team member brings to the table. And I don't care if you started 2 weeks ago or you've been there 20 years, every idea is appreciated. Everybody has a voice, and that's an area that's unique in a lot of areas. You don't see that very often. That's the culture that I've always tried to create and continue to do so. And it's really helped in a lot of ways. Open policy, open door policies. People can call me, connect with me. I'm always accessible, and a lot of our leaders, I would say all of our leaders are the same way. They want to hear those ideas. They want to connect with their team members, and they value their thoughts and opinions. And sometimes the feedback isn't always great. Sometimes we have to change things, and something I'm doing that's isn't really seen as is the right direction. I've had that conversation many times, and I appreciate that. I think to be able to tell your CEO or your CFO or your operations director that something's not working right. That's the kind of culture you want, because you want people to help fix things. You don't want to just keep doing with status quo, because status quo you don't move the needle. So that's my I call it the leadership culture and style that we've always work towards and continue to do so.
Well, it sounds like a great place to work, David. So thank you for sharing that. And this podcast is all about vocal leadership. I've seen a lot of your leadership posts on LinkedIn. I know you mentioned that you have a conference after this podcast, so it seems like you are a very vocal leader. How has that helped you over the years? And do you have a certain process to, being a vocal leader? How do you put all of your content together? And how have you created your process over the years?
So really just surrounding yourself with the right people, showing up to the right meetings, really about being part of organizations, professional leadership organizations. So in our area, NIONAL, American Nurses Association, American Nurse Leadership Organizations, but also the professional organizations for executives, really just finding areas for learning, never stop learning, because for me, that's been a big area where I learn new things from others and surround myself with a lot of people smarter than myself. I feel like that is a key attribute to a smart leader is you know your limitations and find people that know things and can do things that you can't. And that has been a really a great opportunity for me to find and surround myself with the right people. So our marketing team, PR, our leaders, whether it's within finance, account management, you name it. We are always trying to recruit folks that bring a different level of thinking to the table. And for me, or for any organization, that is key to see your success. Hire slow, and make sure you hire smart. Find people that are not just intelligent and creative, but also attitude, I'd say, is equally as important. Find people that really, truly care about your mission, your vision, what you're trying to create, and they have a good attitude, and they're positive people that really want to make a difference.
Well said. And what advice would you give to other aspiring healthcare leaders looking to make a positive impact in the industry?
I would say, think big, take risks, fail a lot, and learn from those failures. I could tell you many times I've had many projects that went south and didn't work, and that's okay. You just pick yourself up, brush yourself off, you get back up, you keep going. You're never gonna, whether you're going into any space within business, you have to understand and you're yourself, you have to recreate things. You have to try new things. Not everything's going to work. It's a very volatile and interesting landscape within business. There's a lot of areas where technology has taken a lot of those areas and making it easier to do things, but a lot of times it makes it more difficult for communication, for connecting. So I think having relationships, I would say, is number one. Build those relationships and that connection with people, because technology can't replace people. It can't replace that human element of caring, that commitment to looking somebody in the eye and saying, what can I do to help support you? What can we do together to make a difference? That's the level I see that is missing in a lot of organizations that I've worked with, a lot of vendors I've worked with. When you put the people out there, and they really truly are, caring and committed to the organizations that they're working in, it's gonna do well, and you're definitely gonna outpace the competitors.
And do you have any advice, David, to other CEOs who haven't been so vocal yet, but want to have more of a public presence online and also in person?
I feel like you need to get out there. You need to really stand up for what you believe in, but you have to do it artfully, creatively and positively. I mean, you have to treat people with kindness and respect. I think there's a lot of media posts in other areas where people love to see chaos. They like to see things that aren't always positive. That's not the kind of news you want to surround yourself in. You want to find things that are innovative, creative, and caring solutions for humanity. And I think those are the type of podcasts you want to be on. Those are the type of publications. Those are things you want to post on. So when you're getting yourself out there, always do it. Put your best foot forward. Don't get sucked into the negatives. Try to find the path of good and stick to that, because I feel like everybody's looking for some glimmer of hope, especially in a world that we're living in today. So having that ability to find those channels, those outlets, podcasts of positive, like yourself, it really makes a difference. And it may start small and then grow yourself. LinkedIn is a great channel. I've connected with a lot of folks like yourself, a lot of business professionals that are growing their business, growing their influence. And I think that's certainly a good area to start, is having a LinkedIn presence.
And I think that's great advice, David, to keep it positive. Just like you shared so many inspiring stories today, I'm sure there are many other CEOs as well that may have not gotten started yet, but can be really inspired by your story to also share their own. And to wrap up today, I always love to end with a more personal question.
Sure.
So, Nurses Week is in May every year.
Right.
And what are your favorite off-duty activities during Nurses Week?
Oh, well, I have golden retrievers, and my wife and I hike a lot. So anytime we can, actually, I'm doing a podcast on the 15th about hiking, and how that's a great outlet for people to be in nature. So for me, when you sit in front of a computer, and a lot of business owners, having that disconnection. So for me to be able to be in nature, I still have that pull and that gravity. So any chance I can, I'm out in the wilderness, hiking, boating, kayaking, you name it. A little bit in May is a great time, especially in upstate New York, so you can get out there. But for me, that's my biggest thing for Nurses Week, is just to really support our nurses and let them know the health and well-being of our workforce is so important. We just initiated a program supporting wearable technologies to support the stress, sleep, and activity levels. So we just launched a pilot study, so all of our clinicians have access to an Oura Ring, Apple Watch, or Fitbit technology, and they're in areas where we want to help support them, with all the things that are related to supporting their mental health and overall well-being. So there's a couple areas within Nurses Week that I feel like contribute to that. So I'm really excited about that project that I'm working on. For me, it just reminds me when my watch tells me I need to stand up, or I need to take a breath or get outside. That's an area that all of us could use more of. Just, disconnecting and getting out there and doing something that's part of nature.
And do you have a favorite area to hike that you could recommend to our audience?
Depends what part of the country or part of the world you're in, but I just completed the 46, well, I didn't say just completed, but the Adirondacks is 6 million acres, and people think of New York, if you're not from the area, as just New York City, but it's a very large state, and we have an amazing state park that you can fit 3 other national parks inside of it, because it's over 6 million acres in size. And within that, there's 46 high peaks. They call them high, but in other parts of the nation and country, they're actually small, like hills. But it's just a lot of backcountry, a lot of nature, great part of New York to come visit. So that's an area I would recommend. And then On the West Coast, there's a lot of hiking out there. Sierras are amazing. So if you've never come out and experience, the parks of the United States, come visit, because there's a lot to do and there's a lot to see.
Definitely. And those were really great recommendations. So thank you so much, David, for joining us today. Really enjoyed hearing your story and insights. And until next time.